study pre-invasive disease of the cervix. As we said, it's a preventable disease. Now we study the cervical cancer. مثل ما قلنا, pre-invasive disease or cervical intraepithelial neoplasia does not cross the basement membrane. Today, we study the disease after crossing or invading the basement membrane. The objective of this lecture, the incidence and the classification of the cervical cancer, risk factor and the clinical presentation and staging management of the cervical cancer. Cervical cancer can often be found early and sometimes even prevented entirely by having regular pap tests. Yet, it is the second most common gynecological cancer in women. حالياً, in Europe, it is the fourth cancer in women, but in our locality, Middle East, and in our country is the second most common gynecological cancer, because the screening program or attending for screening program not optimal, not so optimal. Most of these cancers stem from infection with the human papilloma virus, although other host factors affect neoplastic progression following initial infection. It develops in younger population. Cervical cancer starts in the cell lining the cervix, and the cervix have two different parts and two different types of cells. Endocervix covered with the glandular epithelium and ectocervix covered with squamous epithelium. These two cell types meet at a place called transformation zone. وحكيناها بتفاصيل بالمحاضرة اللي كانت حضوري. In which most these two cells meet to a place called transformation zone, in which cell carcinoma, okay, histological type, squamous cell carcinoma, most common type squamous cell carcinoma, 9 of 10. يعني شنو؟ كل 10 cervical cancer squamous cell carcinoma 9 منهم. Adenocarcinoma, most other cervical cancer which develop from mucus secreting gland of the endocervix. Mixed cervical carcinoma, adenocarcinoma. How to diagnose? Symptoms and physical examination. ممكن المريضة تجيني as simple as possible. Large portion presented with cervical cancer may be asymptomatic. كل شيء ما عندها. During the screening program, so we found what cervical cancer. For those with symptom, early stage disease can create watery vaginal discharge, may contain blood between period and after menopause. Okay, watery vaginal discharge may contain blood between a period in reproductive age or in postmenopause. Presented with watery vaginal discharge contain blood. Okay, ممكن تجينا what? Cervical cancer. Intermittent vaginal bleeding that follow coitus or douching as the tumor enlarge, patient may present with uncontrolled bleeding. Pain during sex, dyspareunia. Extension to pelvic side wall. قالوا دكتور جاي يسمعون له لا؟
نسمعش دكتورة.
أي مو إحنا شنو صار عندي disconnection وما انتبهت أنا. Extension to pelvic side wall compress adjacent organ to produce symptoms like lower extremities edema. ممكن local extension of the tumor to the side wall producing lower extremities edema. Low backache radiating to posterior leg. ممكن المريضة تجي شنو sciatica like pain. Often radiating to sciatic nerve root. Lymphatic veins or urethral obstruction may present with hydronephrosis and uremia. ممكن first presentation شنو? What? Uremia. Occasional cervical cancer invade bladder and rectum presented with vesicovaginal or rectovaginal fistula. What about the physical examination? Most women with cervical cancer, normal exam, if microscopic. With advanced disease, a large supraclavicular lymph node, inguinal lymph node, lower extremities edema, ascites, decreased sound, indicate lung metastasis. External genital and vaginal examination looking for concomitant lesion. تعرفون حكينا risk factor for cervical cancer, human papilloma virus, which is also a risk for vulvovaginal cancer. Cervix may be appear grossly normal if microscopic invasion, يعني بعد شنو؟ مو microscopic lesion more than 2 cm. Or visible lesion, endophytic, exophytic, polypoid lesion, or barrel-shaped cervix, cervical ulceration or glandular mass, watery purulent or bloody discharge. By manual examination, enlarged uterus advance may have vaginal involvement. Rectovaginal examination found rectovaginal septum thicker and irregular. Bare rectum examination also may be needed. Tests for women with symptom of cervical cancer or abnormal pap smear result. أي مريضة symptoms of cervical cancer or abnormal pap smear result. أبسط شيء نسويه هو شنو؟ الباب smear. Medical history and physical exam. This include information related to risk factor and symptom of cervical cancer. pap test, not diagnosis. not diagnostic مثل ما حكينا بالمحاضرة السابقة قلنا هو screening test. Not diagnostic but may be done, and abnormal test may mean more testing need. يعني شنو؟ إذا أنا طلع لي باب test abnormal, so I need more testing. Normal باب test, no need for another test. colposcopy اللي حكينا عنها قلنا اللي هي شنو؟ magnification microscope يشوف السيرفكس with magnification more than 40 times. Okay, it's abnormal test, BAP test, an instrument that stay outside the body with magnifying lens. It helps the doctor see the surface of the cervix closely and clearly. It can be done safely even in pregnancy, like BAP test, not do during menstrual cycle. Use acetic acid solution on the cervix of abnormal areas seen, so biopsy done. Biopsy, colposcopic biopsy, abnormal area biopsy, forceps small 1/8-inch section result of mild cramping, brief pain, slight bleeding under local anesthetic agent. ممكن شنو colposcopic directed biopsy, or sometime what? Or sometime we do biopsy, another biopsy under general anesthesia. Endocervical curettage وقلنا ليش نسويه؟ لأن إحنا ما نقدر نشوف الترانسفورميشن zone, which is area vulnerable for pre-invasive and cervical cancer or invasive disease. So we do endocervical curettage. Cone biopsy, remove a cone-shaped pieces of tissue from the cervix, including the transformation zone. Cone biopsy, not only diagnostic, but also therapeutic treatment. It completely removes the precancerous lesion. It can done large loop excision or large loop excision of transformation zone under local anesthesia in the doctor office. Directed biopsy or what? Biopsy under general anesthesia. Endocervical curettage and cone biopsy. Imaging has a vital role in determining correct management at initial staging and recurrent disease and complication. What about the imaging? Chest X-ray, pelvic MRI. احنا أول شيء نسويه any case suspected cervical cancer, what we do pelvic MRI لأن السيرفكس شنو soft tissue. So we do pelvic MRI imaging, determine tumor volume, parametrial extension, confirming that the tumor is confined to the cervix, nodal status. CT scan are usually done if the tumor larger or if there is concern about cervical spread. Intravenous urography rarely used if any abnormal area from cervical cancer obstructing the ureters. Positron emitting tomography, this test helpful if cancer spread to the lymph node using a special glucose contain radioactive atom. Cancer cell in the body absorb sugar using a special camera can detect radioactivity. Cystoscopy, proctoscopy, and examination under anesthesia is often done in women who have large tumor. أي مريضة تجيني large tumor وأتوقع pelvic side wall metastasis even before MRI or when we do MRI and large, not exactly. So I want to check examination under anesthesia to exclude local pelvic side wall metastasis. ليش؟ يفيدني. يفيدني وين؟ بالتريتمنت. ممكن هاي المريضة أشتغلها عملية أو لا. Staging. There is a clinical staging and surgical staging. Clinical staging, CT scan, MRI, and positron emitting tomography. The tests used during cervical cancer staging: CBC, urine analysis, liver function test, renal function test, radiological chest X-ray, IVB, CT scan, and MRI. Procedural like cystoscopy, proctoscopy, examination under anesthesia. We have different staging. FIGO staging based on physical exam. إذن FIGO staging هو شنو؟ clinical staging. Other tests in some cases ونحتاج شنو؟ بعض التيست. TNM staging اللي هو شنو؟ after histopathological. Surgical staging اللي هي lymph node dissection, pelvic and para-aortic lymph node. We do dissection to the pelvic and para-aortic lymph node after histopathological. So this is a surgical staging, while FIGO staging is a clinical staging. Prognosis, what about the prognosis? طبعا شنو عندكم مرفقة الستaging تحفظوها درخ السيرفايكال كانسر staging وترسموها. ترسمون السيرفكس وتشوفوا حتى ما تنسوا ترسموه. The 5-year survival stage 1A 100%, stage 1B 88%, stage 2A 68%, stage 2B 44%, stage 3 18 to 39, and stage 4A 18 to 34. يعني شنو أقصد بيها؟ 5-year survival if proper staging and precise treatment, so 5-year survival. يعني هاي المريضة راح تبقى ويانا عايشة 5 سنوات. إذا أنا خطأت بالستيجينج ووراها شنو أخطأ بالتريتمنت، so the 5-year survival أقلله علما للربع. يعني مريضة ستيج 2 أو ستيج 1B وخطأت بالستيجينج ممكن ال1 year 5 year يتحول إلى سنة أو ال5 year يتحول إلى 6 أشهر. شلون؟ treatment. primary disease stage 1A type 1 hysterectomy. Okay, type 1 hysterectomy. stage 2A2 radical hysterectomy. شنو الفرق بين اللي radical hysterectomy و type 1 hysterectomy? type 1 hysterectomy remove the cervix and the uterus plus minus the ovaries with no touch the parametrium. radical hysterectomy اللي هو أصعب من type 1 hysterectomy remove the cervix, uterus plus minus ovaries with parametrium. يعني soft tissue around the cervix we remove. تعرفون اليوترس من فوق شنو بالابدومن؟ فري اوكي، تتصل بيه شنو؟ البرود ليجمنت، fallopian tube and ovary and free, no attachment. البارامتريوم اللي هو شنو البارامتريوم؟ the soft tissue laterally to the side wall اللي هو pelvic side wall اللي قريبة على السيرفكس. So radical hysterectomy we remove also the parametrium وتكون صعبة ولازم تحتاج well expert gynecologist. So or primary stage disease اللي هي stage 1A up to stage 1B, stage 1A type 1 hysterectomy, stage 1A2 radical hysterectomy. حكيت لكم مثال بالمحاضرة السابقة، قلت لكم المريضة إذا wish to conceive or not complete her family we do what? Trachelectomy, remove the cervix, okay, just amputation of the cervix and close follow up. Before do trachelectomy, what we do pelvic MRI to see the tumor size, pelvic side wall metastasis, and sometimes we need positron emitting tomography to exclude nodal metastasis. إذا صار nodal metastasis, what we do? So we want to finish the cancer. Okay, if the tumor confined to the cervix, يعني stage 1A, stage 1A2, so what we do, trachelectomy if the patient wish to conserve fertility. MRI is performed pre-op to assess tumor size and location, exclude tumor greater than 2 cm, involvement of uterine isthmus. Stage 2, stage الو
الو نعم دكتورة.
اوكي. stage 1B and up to stage 2A either surgery or radiotherapy. كان المريضة عندي stage 1B أو stage 2A, so what we do either surgery or radiotherapy. يعني مو شرط أنا إذا المريضة obese وزنها 150 140 مريضة عندها comorbid disease, so what I do radiotherapy. If I do surgery, the complication of surgery, post-operative complication after radical hysterectomy, what more than the cancer per se. So I decrease the survival rate, ال 5-year survival rate. ممكن مريضة وزنها 140 أو cardiopulmonary compromise وهي شنو stage 2A وأنا أريد أسوي surgery، يعني ما اختاريت التريتمنت الصحيحة البريسايز. So the 5-year survival what? Decrease, lower the 5-year survival. So radical hysterectomy. الو
نعم دكتورة. Yeah.
Okay. Radical hysterectomy selected for young patient with low body mass index, wish to preserve ovarian function and have concern about sexual function. يعني شنو السيرجري متى اسوي هذا المريضة young low body mass index تريد تحافظ على الاوفريز او شنو concern about what the sexual activity. لأن شنو هو الراديكال اللي radiotherapy intracavity inside the vagina or external beam radiation شي يسوي destruction للovarian cell or ovarian tissue or what tightening of the vagina. Stage 2B up to stage 4A advanced stage cervical cancer treatment of this tumor may be individualized to maximize patient outcome. يعني شنو إذا عندها مريضة local metastasis to the bladder, to the rectum, so individualize يعني على مود أحسن the quality of life. So poorer prognosis radiation therapy may be external beam radiation or brachytherapy اللي هو intracavity radiation, and currently chemoradiation bill cervical cancer. Radiation used for advanced cancer, pelvic accentuation by removal of the bladder, rectum, and uterus if present, and surrounding tissue. Stage 4B, very poor prognosis and treatment with goal of palliation. يعني شنو? Lung metastasis, what we do, pleural fusion, chest tube,